What to know about antibiotics? Anti-toxins, otherwise called antibacterials, are drugs that annihilate or hinder the development of microscopic organisms. They incorporate a scope of incredible medications and are utilized to treat illnesses brought about by microorganisms. Anti-microbials can't treat viral contaminations, for example, influenza, and most hacks. This video will clarify what anti-infective agents are, the manner by which they work, any likely results, and antimicrobial opposition. Quick realities on antitoxins. Alexander Fleming found penicillin, the principal regular antimicrobial, in 1928. Anti-infection agents can't battle viral diseases. Fleming anticipated the ascent of anti-infection opposition. Anti-infection agents either execute or moderate the development of microbes. Results can incorporate loose bowels, a furious stomach, and queasiness. What are antimicrobials? Anti-infection agents are incredible drugs that battle certain diseases and can spare lives when utilized appropriately. They either prevent microorganisms from duplicating or annihilate them. Before microorganisms can increase and cause indications, the resistant framework can normally execute them. White platelets WBCs assault hurtful microscopic organisms and, regardless of whether indications do happen, the invulnerable framework can normally adapt and fend off the disease. At times, notwithstanding, the quantity of unsafe microscopic organisms is extreme, and the invulnerable framework can't battle them all. Anti-infection agents are helpful in this situation. The primary anti-infection was penicillin. Penicillin-based anti-infection agents, for example, ampicillin, amoxicillin, and penicillin G, are as yet accessible to treat an assortment of contaminations and have been around for quite a while. A few kinds of present-day antitoxins are accessible, and they are generally just accessible with a remedy in many nations. Skin anti-infection agents are accessible in over-the-counter OTC creams and salves. Opposition. Some clinical experts have worries that individuals are abusing anti-infection agents. They likewise accept that this abuse contributes toward the developing number of bacterial contaminations that are getting impervious to antibacterial meds. As indicated by the Habitats for Infectious Prevention (CDC), outpatient antimicrobial abuse is a specific issue. Antitoxin use gives off an impression of being higher in certain locales, for example, the Southeast. Utilization of carbapenems, a significant class of last-line antitoxins, expanded altogether from 2007 to 2010. Alexander Fleming, talking in his Nobel Prize Acknowledgement Discourse in 1945, stated, "At that point there is the peril that the uninformed man may effectively underdose himself and by presenting his organisms to non-deadly amounts of the medication, make them safe." As the one who found the principal anti-infection just about 70 years prior anticipated, drug obstruction is beginning to get ordinary. Opposition. Some clinical experts have worries that individuals are abusing antitoxins. They likewise accept that this abuse contributes toward the developing number of bacterial contaminations that are getting impervious to antibacterial drugs. As per the Communities for Infectious Prevention (CDC), outpatient anti-infection abuse is a specific issue. Anti-infection use has all the earmarks of being higher in certain areas, for example, the Southeast. Utilization of carbapenems, a significant class of last-line antimicrobials, expanded essentially from 2007 to 2010. Alexander Fleming, talking in his Nobel Prize Acknowledgement Discourse in 1945, stated, "At that point there is the peril that the uninformed man may effectively underdose himself and by presenting his microorganisms to non-deadly amounts of the medication, make them safe." As the one who found the primary antimicrobial very nearly 70 years back anticipated, drug opposition is beginning to get ordinary. A specialist recommends antimicrobials for the treatment of a bacterial disease. It isn't successful against infections. Know whether a contamination is bacterial or viral serves to adequately treat it. Infections cause most upper respiratory parcel contaminations, URTIs, for example, the basic cold and influenza. Anti-infection agents don't neutralize these infections. On the off chance that individuals abuse antitoxins or use them inaccurately, the microbes may get safe. This implies that the anti-infection turns out to be less successful against that sort of bacterium, as the bacterium has had the option to improve its guards. A specialist can recommend a wide-range antimicrobial to treat a wide scope of diseases. A limited-range antitoxin is just powerful against a couple of sorts of microorganisms. A few antitoxins assault high-impact microorganisms, while others neutralize anaerobic microscopic organisms. High-impact microbes need oxygen and anaerobic microscopic organisms don't. Now and again, a medical care proficient may give antitoxins to forestall as opposed to treat a disease, as may be the situation before medical procedure. This is the prophylactic utilization of antimicrobials. Individuals ordinarily utilize these antimicrobials before entrail and muscular medical procedure. Results: antimicrobials generally cause the accompanying results: loose bowels, sickness, heaving, rash, agitated stomach. With specific antimicrobials or delayed use, contagious contaminations of the mouth, stomach-related parcel, and vagina. More uncommon results of anti-infection agents include development of kidney stones, when taking sulfonamides. Unusual blood thickening, when taking a few cephalosporins. Affectability to daylight, when taking antibiotic medications. Blood problems, when taking trimethoprim. Deafness, when taking erythromycin and the aminoglycosides. A few people, particularly more seasoned grown-ups, may encounter gut irritation, which can prompt extreme, grisly looseness of the bowels. In more uncommon examples, penicillins, cephalosporins, and erythromycin can likewise cause aggravated insides. Hypersensitivity. A few people may build up a hypersensitive response to anti-infection agents, particularly penicillins. Results may incorporate a rash, expanding of the tongue and face, and trouble relaxing. Unfavorably susceptible responses to antimicrobials may be quick or postponed extreme touchiness responses. Any individual who has a hypersensitive response to an anti-infection must tell their PCP or drug specialist. Responses to antitoxins can be not kidding and now and then lethal. They are called anaphylactic responses. Individuals with decreased liver or kidney capacity should be careful when utilizing antitoxins. This may influence the kinds of antitoxins they can utilize or the portion they get. In like manner, ladies who are pregnant or bosom taking care of ought to talk with a specialist about the best antimicrobials to take. Communications. People taking an antimicrobial ought not take different drugs or natural cures without talking with a specialist first. Certain OTC prescriptions may likewise communicate with anti-infection agents. A few specialists recommend that antimicrobials can diminish the viability of oral contraceptives. Be that as it may, research doesn't by and large help this. Regardless, individuals who experience loose bowels and regurgitating or are not taking their oral preventative during ailment in view of an annoyed stomach may find that its viability diminishes. In these conditions, avoid potential risk. Step-by-step instructions to utilize. Individuals generally take antitoxins by mouth. Notwithstanding, specialists can regulate them by infusion or apply them legitimately to the piece of the body with contamination. Most antimicrobials begin battling disease inside a couple of hours. Complete the entire course of prescription to forestall the arrival of the contamination. Halting the medicine before the course has completed expands the danger that the microbes will get impervious to future medicines. The ones that endure will have had some introduction to the antimicrobial and may thusly create protection from it. And individual requirements to finish the course of antimicrobial treatment even after they see an improvement in indications. Try not to take a few anti-infection agents with specific nourishments and beverages. Take others on a vacant stomach, about an hour prior to suppers, or 2 hours after. Adhere to the directions accurately for the medicine to be viable. Individuals taking metronidazole ought not drink liquor. Maintain a strategic distance from dairy items when taking antibiotic medications, as these might upset the ingestion of the medicine. Q. Are there any microorganisms that are impervious to all antimicrobials? Alan Carter, Farm. There are a few unique kinds of microorganisms that are impervious to the anti-infection agents that have been the best against them. A few models include ethicillin-safe Staphylococcus aureus MRSA, multi-drug-safe Mycobacterium tuberculosis MDR-TB. Carbapenem-safe Enterobacteriaceae CRE, gut microorganisms. Vancomycin safe Enterococcus VRE. At the point when one of these microorganisms causes a disease, it tends to be exceptionally troublesome, if certainly feasible, to fix.